energy on a big scale. When someone walks into a room and you love them, guess what? Their conformational change by interacting in that room changes your energy and the outflow therein. So either one has to do about the manifestation and the experience of energy. Now, usually when I do this talk, it's to a bunch of healthcare practitioners. In fact, the last time I gave this, I think there was about 150 psychiatrists in the audience. So I started out with an MRI scanner. And how many of you have had an MRI? Okay, what happens when you have an MRI? You go in a big tube, this thing spins around, and then it clicks a bunch once it stops. What it's doing, it's exposing the protons in your cell nucleus to 0.2 to 3 Teslas of electromagnetic energy. The protons spin around the cell, and basically, when that big tube stops spinning, the protons slow or degrade, and it creates an electromagnetic frequency that you can take a picture of. And the pictures are different depending on the mass of the tissue that's being imaged. Now what that means is there's a place the mass is different in that tissue. We call that dis-ease, or a change in frequency or vibration. So that dis-ease would show up in someone who had cancer as a tumor. It may be an abnormality for what that structure should look like. It's not a far jump if you believe in the science of MRIs to talk about the science of the body. So every single experience in looking at the body, you can jump to the fact that we have electromagnetic frequencies that are influenced by what we think, what we do, the earth, and they're called chakras. So if you look on this side of the screen, on your right side, you see the energetic manifestation of the energy centers of the body called chakras. If you're in a different world, maybe you call it by a different name. Chi, prana, mana. Well, I was walking through a flea market in Hawaii, and this old Hawaiian woman looks at me, she goes, "You know mana." And I'm like, okay. And she gave me a beautiful pendant. But, you know, the places that they travel, we call koshas, nadis, and meridians. In fact, the evidence for this in the Western medical symbols, anybody knows what these are called? Caduceus. Everybody knows the medical symbol for physicians, the caduceus. The one next to it is the medical symbol for doctors of pharmacy. It's called the bowl of Hygeia. Either way, you have snakes going up and drinking from the seat of knowledge. But actuality, the real story has to do with the ancient Vedas and how energy travels in the body, the chakras being the places that take the energy and distribute it through the sushumna, or the spinal cord, to all the organs, all the cells, and manifest the energetic changes and points of the body. Now, I love this one. How many of you have ever used a mala? Do y'all know what a mala is? Okay, so this is a mala that I've used for many, many, many years, and they're beads. And this has 54, but when you do part of yoga therapy, which is called repeating affirmations or mantras, you do 108 of them in repetition for 40 days, each day for 40 days. Well, guess what you're doing? You're using sound energy to increase the vibrational frequency of the body. Every time you repeat an affirmation, you clear one of the 108 energy meridians or channels. This is from the Vedas. So when we look at the 8 limbs of yoga, I mean, I've been teaching yoga since 2001. And, you know, I say, well, I'm a yoga instructor, I'm a yoga therapist. And they go, oh, I can't bend. And I'm like, well, maybe it's not the body, maybe it's the mind you're trying to change the perception. And we talk about things to do societally, the yamas, the niyamas, things to do personally. Asana is the movement of the body. And then we have various other experiences that we talk about in yoga therapy. Pranayamas, how we manage the breath. So one of the things that I often teach is if somebody's really anxious or thinking about everything in the future, Or they're really, really depressed and they're thinking about things that happened in the past and they're ruminating. I'm like, live in the lungs. The lungs don't have a brain and they don't have places that are embedded. They just breathe. So, you know, pranayama is a big part of therapy to help manage the emotions. Pratyahara, I call it internal hiking or turning inwards, part of the process of meditation. Dharana is basically looking at concentration. And then dhyana is letting go of it all. When you remove the sense of self-importance and connect to the divine, we call that samadhi. Whereas you disappear so much in your practice that you know you're part of everybody else, that you're part of one with the universe, and you feel that intention, and we call that practice samadhi. As a yoga therapist, we have the Panchamaya model of health using the 8 limbs of yoga, and there's 5 aspects of it: spiritual, mental, emotional, energetic, and physical. And we use the model, the Panchamaya model, to be as a bird. So our physical aspects of our body is what we live in the current experience of our soul's light. The emotions and the energy is our wings. The mind has a dristi, or a focus of where it wants to go, but our guiding experience are the tail feathers. It directs our experience, and that's the spiritual. When I talk about pharmacology, I'm like, well, energy's, as I said, it's ubiquitous, whether we're talking about mini things or macro things. And pharmacology, for me, is kind of a spiritual experience. So when I talk about, with regard to pharmacology, I have the kinetics, what happens in the body. And I will tell you that in pharmacy school, we had a class called chronopharmacology, the study of the moon on the pharmacokinetics of medications. So if you talk about the full moon was at 9 a.m. this morning, the peak. I don't know if anybody's been feeling a little squidgy, but it can actually change the volume of distribution for medications to render them less effective. So some people have exacerbation of symptomatology around the full moon. It's not an uncommon thing, because not only is that about medications, but it's about neurotransmitters, and hormones are less effective during that time. The mechanism of action is the physical aspect of binding to a receptor site that results in a change, just like walking in the room. If you were a mini neurotransmitter and this was a huge nerve, you know, sometimes you walk in and the vibe's not great and you're like, I want out of here immediately. The other times you walk in, it's like, yay, I'm home. So all of those are conformational changes. The dynamics is the energetic signature that occurs in pharmacology. And the resultant changes in all of that hopefully lead to improved health and quality of life. So if I apply this to the Panchamaya model, the bird is how the body handles, and it can be any substance. It can be, you know, your neurotransmitter, it can be a medication, it can be anything that has a half-life in the body. What we see is that the arms are the mechanism of action, how things work, and the energy that changes. And then where we go, hopefully, is improved health, hopefully not too many side effects, but you really need to look at quality of life as your guide about medication and different types of therapies that you do. And I'll be the first to say, medication is not everything. It just helps you get out of that hole the symptoms have you in. If medicine puts down a ladder, you climb out, and it's everything else that you do to contribute to your health that makes the huge difference. So I'm going to switch to some of the aspects that I learned in yoga therapy about meditation. I've been a meditator since 1997. I was a visiting professor in India, got really interested in the aspects of Ayurveda and yoga practices. And what I was taught in the Vedas, there's a lot about meditation, but one is that to meditate at the seat of the chariot of Savitar, the Surya of the divine. And Savitar means sun, and Surya means the divine energy coming through. So in a lot of places that I studied, they're like, meditate at the seat of the sun. Some people get up in the morning and really look at the sun. That may be part of it, but it's not everything. I think it's more of an anatomical correlate. How many of you recognize the Egyptian symbol of the Eye of Ra? Beautiful, isn't it? It's the ultimate symbol of health. Guess what? You can overlay it on a sagittal section of the brain and get information about the anatomical correlates for the seed of meditation. Ra means God of the sun. And I will tell you, part of the experience is that of the, I'm sorry, I'm switching slides. Is the question I always have, is the pineal gland the seat of the sun? And that is the question. Every single meditation practice that I've done that's a deep experience of meditation, how many of you have been told to, you know, picture or feel the tops of your ears and draw a line to the other one, and then from the Ajna chakra to the back head chakra and draw a line, and where they cross, drop in and focus your attention. Guess what anatomical correlate that is? The pineal gland. Beautiful thing. The pineal gland's fascinating. It's reactive to light through the optic nerve. It contains pinealocytes. It manufactures melatonin. It has a feedback loop to norepinephrine. It promotes neurogenesis of the brain, and it's the only structure of the brain that is equally present in both hemispheres. Hemispheres are mirror images of each other. The pineal gland is a single point of focus that is shared equally between two hemispheres. And I really like pictures, and this is my world as a pharmacologist. This is a neuron of the pineal gland. And what it shows you is all the beautiful structures and energy systems that are present within the pineal gland. Around the edge, you see different receptors. You see an innervation, or the norepinephrine system, that big line going back to it. The pineal gland also has a shutoff valve for the norepinephrine system. Norepinephrine is important for mood. It's also that fight or flight moment with regard to the experience of your sympathetic and parasympathetic drive. Now I'm going to switch because I can see some eyes starting to close. It's a little too much. On the macrocosm, the experience of the pineal gland is it's the beginning of the cascade for the HPA axis, hypothalamic pituitary adrenal axis. And it's the place that starts most of the sympathetic, parasympathetic balance. As a pharmacologist, most everything that we make with regard to new medications has to do with modulating the system. You think about it, high blood pressure, sympathetic overdrive, depression, norepinephrine underdrive. We're always making medications to modulate this experience. So when we look at the practice of meditation and how it relates to this, is that we're really talking about meditation is a technique to modulate sympathetic parasympathetic balance. And I didn't mention the vagus nerve, but it also has to do, you've seen a lot of things probably on the internet about the vagus nerve. That's also a place of innervation as well. I looked up on Wikipedia, what is meditation? A lot of you are long-term meditators, I know this, so I'm not telling you anything you don't know. But it's a technique. Basically, it's a practice that you do over time. It's a technique, and it is about mindfulness, about focus, and training your attention or awareness to achieve, eventually, a mentally clear and emotionally calm, stable state. But I will tell you, that's just the mechanics. My question for you all is, why meditate? Any thoughts about that? Go for it, Peyton.
Connectivity.
Connectivity. In what way?
The greater energy field.
The greater energy field. Some people say the divine. Connectivity to your own energy field. Connectivity for your neurons, because I'm going to present to you a few brain studies about what happens when we meditate. But, you know, when I talk about why meditate, it's a bunch of things, really. It's upgrading your self-care, number one. For me, it's the development of faith and consciousness at the same time. And I'm going to have, so I need everybody's attention. I'm going to split from the beautiful shirt with the birds on it down the middle of the congregation. And I would like this side of the congregation, when I say go, I would like you to hum this side, okay, when I say go. And when I do this, it means stop. I would like this side of the congregation, when I say go, to talk loudly until I do this, okay? So 1, hummers until I stop, and talkers until I go like this, okay? On the count of 3. 1, 2, 3, go! So I will tell you, I was reading an ancient text from, not ancient, but I was reading a text from the early 30s by a guy named Deng Lei. And he said, we are all children of the divine. And he said, this Tibetan guy, and he said, well, you know, rabbits have baby rabbits, cows have baby cows, dogs have baby dogs, cats have baby kittens. So if you're a child of the divine, you're a baby divine. So the presence is in you of the divine at all times. It's just like humming. It's always there. It's just you have to use meditation to quiet the left side of the brain from the commentary enough to hear it. And that's really the practice of meditation, is that essence. And I wanted to ask, has anyone ever had more faith by thinking about it? I mean, you know, I can say probably, but really you have more faith by feeling it deeply. And that's a right-sided brain occurrence. So quieting the brain long enough to feel the presence of the divine is really, at least for me, my goal in meditation. And the secondary goal is to be the light that walks in the room instead of sucking the light out. So it's a really important piece too. Oh gosh, the benefits of meditation, there's so many. We know that statistically there's a decrease in stress hormones, the feeling of stress, improvements in anxiety and depression, that health and wellness improves, self-esteem. Somebody talked about that today in self-awareness, navigating hard emotional states, improvements in resiliency and adaptivity, neuroplasticity. And actually, that's one reason with Circlesongs we have so much fun, because we play games that increase our neuroplasticity. We change brain structure and pathways, so critical. And I also wanted to put up a picture about cleansing the energetic anatomy. This is from the pranic healing group, talking about the effect of the Twin Hearts meditation, which I'm going to talk about in a minute, to clean the energetic anatomy. And the reason that it happens is you can't run divine energy through you without clearing out the junk. So if you ask to be a conduit for the divine energy to bless the earth, guess what? You cleanse your own energetic anatomy before that happens, which is pretty cool. When did the medical community start to pay attention? We know that we've paid attention, those of us who are meditators, and we know that there's thousands and thousands of years of writing and experiences. But guess what? When Harvard publishes a study that said you increase your gray matter for memory and change the brain anatomy through meditation, it starts to become a little bit more popular. And in fact, some of the things that I got really interested in was what happens during meditation to the brain. And there's a bunch of different aspects of brain waves that are important, but these three in particular have measurements during meditation. Alpha waves basically associated with periods of relaxation. Theta waves associated with rapid eye movement and heightened creativity. But these gamma waves, they're the bomb. The reason is that I got interest in this 20 years ago, a guy named Charles Rays, and he's a psychiatrist from University of Wisconsin, did a study looking at Tibetan monks who had meditated all their lives. And during periods where they were deep in meditation, these gamma waves increased and were associated with periods of bliss and feeling connected to all, the samadhi experience. The other people that do this quite a bit are musicians, trained musicians who are in the zone of playing, and it's also associated with high IQ and increases in cognitive functioning. So Jeff Tarrant, he's a psychologist that actually did evaluations of meditators during the Twin Hearts meditation, the pranic healing group. And the folks that you see in the brown are people who have been doing the Twin Hearts meditation for a really long time. I've been doing Twin Hearts meditation more days than not since 2003. And what you see in the brown is that the novice meditators that started, they had a huge increase in their alpha waves when they started doing Twin Hearts meditation. The folks in the green actually had a decrease, but those are the folks who had been doing the meditation for years and years. What you see is the importance here of a daily practice, or as much as you can. I'm not going to say daily, but regular practice. Because this is the Twin Hearts meditation measuring gamma waves. In the experienced meditators in the green, those elevated dramatically on their EEGs. That period of bliss, that period of dropping in, versus the novice meditators didn't have much of a change. They got the relaxation, but it really takes time to get to that period of connectedness. So what did I do? I measured my own EEG, right? So this is me doing Twin Hearts meditation in my usual space, my usual time, and you see a very much calming of my thought process. And then I decided, well, let's do it in a different situation. This is me getting ready to go to O'Hare and jump a flight to go do some talks. And much different. I need to practice, and I still do. So depending on the situation, things can vary, but it's pretty cool. Transcendental meditation has a bunch of studies that are lovely. And what they showed is a high coherence with alpha waves for heightened states of creativity, looking at concept learning, academic performance, health issues, self-esteem, all correlated with this. And I had to also, as a musician, I wanted to see what are these sound meditations about. And in 2017, I met Alexandre Tanos, and he really changed my concept. This is from his website. And what you see is a baseline of thought process on EEG. You see reactions to a large amplitude gong, a rain stick, koshi chimes. And one of my places of study that I was looking at for a mechanism of disease for schizophrenia was something called the trace immune-associated receptors, the receptors of smell that also have correlates in the limbic system and prefrontal cortex. This is the EEG reacting to the smell of Palo Santo burning. Isn't that cool? I mean, I'm sorry, just a little aside. Richard Miller, he has a technique called iRest. And Richard lived with Krishnacharya in India as a young man. He became a psychologist, and he was assigned to Bethesda as the lead psychologist for people returning from war with severe post-traumatic stress disorder. And if you look at the top, anything you see in purple and blue is really good. Blue is an improvement, and purple is, let's see. No, I'm sorry. Purple is an improvement. Blue is a complete resolution of symptomatology. And this really caught on. So what you see is the iRest technique being used in every VA in the country right now. The lower one is the control group. You see, they didn't have improvement in much of their symptoms of post-traumatic stress disorder. And the iRest technique is used all over the world. People suffering from post-traumatic stress disorder from all types of experiences. I love this study. If you want to know health outcomes, follow a group of 2,000 meditators for 5 years and look at their health outcomes. And the folks in the red were not meditators. The folks in the blue and the large health data claims database The blue were TMers and the red were not. So you see outcomes and hospitalizations across the board. So since I lecture to a bunch of healthcare professionals, usually with this, I made my recommendations. And these recommendations, I made a chart of the things that I would recommend that have statistical studies with control groups looking at outcomes that are positive. And those are 4 techniques of meditation. Mindfulness-based stress reduction. Judson Brewer, he was my teacher. I took classes on this technique at Harvard. Yoga Nidra or I-Rest from Richard Miller. Transcendental meditation, Maharishi Mahesh Yogi, and Twin Hearts meditation from the Pranic Healing Foundation. The reason I love these is because they have studies that I can talk to Western professionals and say, hey, these really work. You may have your own technique that works just as well, but this is what's in the literature. Rigorous training, certifications, all important. Recommendations for developing a meditation practice. I would say that for me, and what I've been taught, is to have a container for your meditation. So that includes some sort of ritual to open the space. Maybe it's chanting Om 3 times. Maybe it's ringing a bell. I like tingshas, so, you know, starting to clear the palate of the brain for meditation. It may be saying an invocation to solidify your belief systems. Exercise is really important. And what I mean by that is you want to clear the container. So some sort of exercise. I have something that I do 12 times, trying to move every part of my body. There's 12 chakras. It's all part of that. Breathing, doing the meditation, doing exercising, closing the space. So those are the recommendations if you want to know. It's really simple meditation. Sit with your back fairly straight, looking at being aware of your breath and coming back to the breath when you start to think about something else. Thinking's not a bad thing. In fact, oftentimes it's expelling stress, but when you notice yourself thinking, just come back to the breath and the technique for meditation. So I always say just train your mind puppy to sit and stay. That's like meditation. And for some people, it's too hard to do that. So there's recorded meditations that are lovely. Just hit play. That's a big part of it. I leave you with a few exercises. Write your own obituary. I did that in 2017 in a meditation retreat. And I looked at it and said, is your life consistent with your personal goals? And what was missing was singer. I love to sing. I gave it up. And in 2017, I want that in my obituary. So guess what? I made a study of it. And now I lead singing groups. It's so awesome. Because the vibration of sound is a way for me to bring in the conduit of divine and change the conformational energy in the room. I love singing. So what are your I am statements? I can tell you that this is from a book, The Quinn Essentials. And I loved it because it was like no matter what, I can go back, how I'm feeling, I can go back to who I really am. And my I am statements, I'll tell you like a few of mine. I am loving, I am loyal, sometimes to a fault. I am loyal, I'm kind, I'm generous, and I'm open-hearted. And I also have one, I'm fun. Not all the time, but I try. Be your own best friend. And have a personal song that is your go-to. And something I learned in the corporate world, Gepo it. Good enough, proceed onward. Don't get stuck in what is it. I do have a question for you. What are these things? Synapses. What? Synapses, yes. Yes, one, possibly. Possibly. It looks like an eyeball.
Outer space.
There you go. So one of it is a electron microscopy of a brain cell, and then the other is a telescopic picture of a galaxy from NASA. There may be more to all this energy work than we know. I was looking at this one day and I thought, well, if we have an energetic anatomy and everybody else has an energetic anatomy and it goes to big to small, I'm like, what if the northern lights or the crown chakra or the earth? What if the earth has an energetic anatomy? That would be pretty cool. And I found this picture of the sun, which I absolutely loved, because it really reminded me of the energetic sequencing of the nerve cell in the pineal gland. And this is a high-frequency X-ray and a low-frequency X-ray and an infrared ultraviolet X-ray put on top of each other. And it's a picture of the sun. It's a beautiful thing. We just don't know what it is. And then the last thing I'm going to leave you with, first off, thank you so much for your attention. But it's one of the best advice I ever received, and that is work honestly, meditate every day, meet people without fear, and play. This is Baba Hari Das. And when I was doing my yoga training many years ago, it was held at the Mount Madonna Ashram, and it was the establishment by Baba Hari Das. And he was in his 80s at that point in time. He took a vow of silence in 1952 and didn't speak or laugh or anything for 66 years. And I remember, you know, and I'd actually, when I saw him, I recognized him. I'd had dreams where he would come and get me, grab my hand, and we'd go to outer space and float around and look at stuff. And I'm like, oh my gosh, that's that guy in my dreams. And, you know, I saw him and I smiled at him and he smiled really big at me. But I was walking up to the cafeteria and there was a drive-through and there was these big pillars. And he was behind one of the pillars doing this, like, and he was playing with one of the dogs on the property. They were having a great time. And I'm looking at him and I just burst out laughing because here's this, you know, this old guru in white robes dancing around a pillar with nobody else around playing with a dog. So he's one of my favorites. And I hope this has inspired you to continue or start a meditation practice. I have so much more data, and you know, the brain is an amazing thing on the micro level, and the universe is an amazing thing on a macro level. So thank you so much. Yay. Do we have time to do a short meditation? Okay, so I just wanted to give you a little feel for a meditation. So wherever you're at, become comfortable in your chair. If you'd like to close your eyes, you can leave them open too. It's just become aware of your breath. And think of something really, really happy. Something that just like makes your heart sing. And bring that happiness to the crown of your head. And imagine the same beautiful experience of joy and happiness at the crown of your head. And send that joy and happiness, first saying thank you to your heart, your beautiful heart, your resilient heart, your resonant heart, and your beautiful crown, your resonant crown, your resilient crown. And send that joy to the highest place of your soul. Like an offering, like a gratitude. And whatever you give, you shall receive back 1,000-fold. And feeling the highest point of your soul connected to the divine, infusing your crown, your heart, your body with the joy, the light, allowing that golden divine energy to infuse every cell in your body. As you breathe in, the golden love and light is picked up by every blood cell, and it transfers to every part of your body. Every cell is healthy and happy. Every cell is healthy and whole. Every cell is full of light. And as you breathe in, allow that light to infuse the space between each cell. The space inside the cell, since 80% is space. Feel the light to the edges of your skin. With your next inhalation, 4 inches outside the skin. "10 feet outside the skin. Feel it filling the room. Golden, divine light and energy from the highest point of your soul through you. Filling the room, filling the town, filling. And just raise your hands at the level of your chest and imagine pouring that light through the palms of your hands to the earth, holding the earth between your hands. Bless every person, every being with the divine golden light. May all people be healed. May all people be whole. May all people be happy. So be it, and so it is. Move your fingers and toes. Wake up and stretch. Thank you so much. God bless. Yes.
Meditative things going on. Can you just tell us how we can participate?
Yeah, and I just forgot. I wanted to leave you for a minute to yourselves. So there is, I have a group called Boone Circlesong, and we play. It's all improv. There's a few songs taught, but not many. And we have a WhatsApp group. And every first Thursday, we're here at Boone UU at 6 o'clock to 7:30. Get here about 5:45 to sign in. We just play. I don't lead meditation things here in Boone, but there are so many different opportunities here. And, eventually as I get more settled, we're thinking about starting some group meditations, especially with Twin Hearts meditations as well. But y'all know what works for you. Just find something, practice it, keep doing it, and find somebody else to practice with. The energetic anatomy of meditating together, the Sushumna, that divine energy channel in the spine, has 7 layers. So anytime you have 7 people meditating together, you form a beautiful conduit like a Sushumna for divine energy to the earth. So meditate in groups if you can. So it's all good. Oh, I'd love to hear discussion, questions, anything y'all want to talk about. Speak.